Good afternoon. My name is Rachel Whitney-Lacey and I'm a clinical nurse trainer at Face Academy based in Brisbane. There are 4 reasons for me applying for Janssen scholarship towards the ACN's Dermatology Postgraduate Certificate, and those 4 things primarily are patient results, my own personal and professional development, the role and the improvement and the benefit towards my professional job as a clinical educator, and finally about the synergy between aesthetics and dermatology as professional interdisciplinary organisations. Firstly, of course, my initial reason is patient results. We train ARPA registered nurses and doctors and dentists sometimes in clinical treatments that include PRP, skin needling, botulinums, neuromodulators such as Botox and Dysport, and of course some of our biological treatments as well. And primarily we are focused on clinical results. Interestingly enough, we are not focused on beauty. We're more focused on a wellness aspect in terms of helping our clients or our patients to feel their best. So many of the demographic or many of the clients that come to see us are essentially professional working women, and they just want to look their best. They're not interested in being immensely beautiful. They're not looking at being 20 or 30 years younger. They just want to reflect on the outside how they feel on the inside. And that is our goal, to help them achieve that, as well as training that to our APRA attendees. So there's another reason. So when I'm thinking personally, sort of from a patient perspective, the other reason that I'm really genuinely interested in dermatology is because we do treatments that deliberately cause trauma to the skin. And even though we might ask to make sure that our patients have had skin checks, we can't always guarantee or necessarily identify underlying conditions such as, i.e. rosacea. Acne is pretty obvious. If there's any kind of hyperpigmentation or hypopigmentation, or potentially those more sinister skin changes that might be happening that we don't necessarily have the skills to pick up. And of course, as nurses, we don't necessarily diagnose those, but we do need to have the skills to recognise it so we can refer to our prescribing practitioners. Secondly, the other reason for me applying, of course, is personal and professional. I really love my job, and I really love my own intellectual development and improving my ability to deliver high quality courses and high quality content to my trainees. So it's professional in terms of, I want to know that when I'm training people such as my GPs who might have a skin excision and cancer background, that when we're talking about patient outcomes and potential complications, that I have a further understanding on things that they might see on a regular basis, such as, again, those little skin cancers, BCCs, we might be seeing squamous cell carcinomas, we might be trying to recognise solar keratoses and how they might be changing. So that will help me to develop professionally, as well as support the information that I can provide to my attending HCPs. Thirdly, of course, and reinforcing that educator role, I want to further develop my complex reasoning skills, my ability to assess what is happening on an interpersonal relationship with my colleagues as well. I am a team member, but I have a number of staff that are under me in terms of skill development, and it is my job as a leader to support them to become the best practitioners they can be. And I really believe that this certificate can help me achieve that. And finally, number 4, of course, is that really great interpersonal relationship that we have between our disciplines. There are many clinicians in aesthetics that really value the connection that dermatologists or dermal therapist nurses and the dermatology profession can support in aesthetics as well. Essentially, we're after the same goals, healthy skin, and how we can help our patients achieve that and learn to take care of themselves. So essentially, that is my video. Thank you so much for taking time out of your busy day to listen to it, and I look forward to speaking to you soon. Have a great day.